Good morning, Dr. Bimpon.
Hello. Hello.
Fantastic. Good to have you on our show.
Yeah, I'm pleased to be on your show as well.
Thank you so much, sir. So yesterday on our health segment, we were touching on cesarean section and a report that said that it's like Ghanaian women are requesting more for CS rather than go the natural way. What
Okay.
What are your thoughts on this trend? First of all, is it a trend that is happening, or is it somebody's mind? Or please tell us from where you sit as an expert on the matter. Is it a trend that Ghanaian ladies are specifically requesting for CS as a way of giving birth?
Okay. First of all, I would like to extend my greetings to your cherished viewers this morning, and I would like to say that yes, we are seeing something like that. It's been on the ascendancy in the current practice that some people do come to the hospital, and irrespective of the professional advice that you give and the insights you give them, they would want to prefer cesarean section to spontaneous vaginal delivery. So it's something we are seeing. Yeah.
Dr. Bimpon, so I think the controversy started when someone had said that the only reason why they were doing that is so as not to get their reproductive organ enlarged. If morning radio, so I'm trying to be very choosy with my words. Would you say that is the reason? I mean, as a doctor talking to them, what are their reasons why they are opting more for CS? Because I'm old. I grew up in the 80s and 70s, and trust me, CS was like a death sentence at the time. So why is it that now is being requested for? What are the reasons women are giving for this?
Okay, just as you rightly mentioned, it looks like right now the voice of the social media is so strong than any professional voice. So I think people are misinformed, and most informations are moving from the media to another media as well. The social media has been the main means of getting information to people. So people are not rightly informed. And I must say that following spontaneous vaginal delivery, I mean, you are not going to get your introitus or the size of your vagina area to be 100% as of the previous size that you had. It wouldn't be 100%. But that doesn't mean you should go in for cesarean section, because cesarean section is a surgery. So surgery comes with its own complications. So if you are to line side by side the issues that can happen following spontaneous vaginal delivery as against that of cesarean section, then it's better to go for spontaneous vaginal delivery.
My colleague who hosts that segment, Ngozi Boateng, is also on the line. Ngozi, do you have a question?
Yes, I do have a question. You know, Dr. Bimpon, good morning. We have had, most of the time, doctors always tell us that it does go back to its original size when we do have the natural birth. But you are saying that it doesn't.
You won't get 100%.
It's not the same. It's not 100%.
Yes.
Okay, so that's.
You get like 95.
95.
Oh, I mean, you can get like 99. Even for some people, the changes you are is negligible actually.
Okay.
For some people, you won't see the changes at all. You won't see it at all.
Oh, okay. But okay, please speak. I'm listening.
Yeah, if you are going in for cesarean section, it means that there are complications that come thereafter.
Okay.
Okay.
You know, so, we have to look out for all those complications. And then, although anytime we want to get somebody to theater, there is a form you have to fill. And on that form, there are some of the main complications listed. But on top of that, we sit you down, we explain the procedure to you, and we let you know the measures we are going to put in place in case they occur, although they are likely that they may occur. Okay. Just that we have to give you the knowledge of it so that you can make an informed decision, especially in our era that the right of patients is so strong. I mean, previously it wasn't like that. Once you speak to a Ghanaian woman that we would want you to do vaginal delivery, they rightly accept it. But right now, it's not like that. They have their right as well.
Yeah.
So people do come for we call it an elective cesarean section, where you tell us ahead of time, we plan it, we do all the hormonal checks, we do all the preliminary investigations, and then we prepare you for the operation. But right now, what is happening, because of the information that is going out there, which is not true, because spontaneous vaginal delivery has a lot of benefits, way more benefits as compared to cesarean section. Some people do, and they have it registered in their mind that they are coming for C-section. Although naturally they want to try the vaginal delivery and have the experience of it. So they go into labor with a mindset and then advice given to friends and what the person has read on social media that I want CS, but subconsciously the person wants to do vaginal delivery. So, and labor is very painful. Yes. It's a very painful thing. So when they are in the course of labor, any little pain, any pain they experience, then they will begin to opt for operation at that moment. And operation that way. So at that moment, you put the medics over there at a very tight corner because we need the anesthetics, we need the theater staff. I mean, a lot of things goes into surgery. You don't just, the moment you come in, I want operation, then we push you to theater. We don't do it like that. But because of this information on the social media, that is something that we are seeing as well.
All right. Dr. Bimpong, can you please tell us some of the benefits of having the natural birth? Just for our listeners, yes, just in case we have a pregnant woman listening in right now, so she can make a smart decision for herself. What are some of the benefits? Yes.
I mean, they are manifold. First of all, there is a period we call the puerperium, or the first 6 weeks after delivery.
Okay.
That is the time that most of the, pregnancy is a physiological process, and after you've delivered, everything has to go back to normal. So this is the period within which the uterus returns to it. The uterus is like a balloon. You have to go back. Once the fetus comes out, it's like you have deflated the balloon and everything has to go back to normal.
Yeah.
The changes that happen, the hypertrophy or increase in size of the cells, everything has to go back to normal. So this puerperium, if you went through the spontaneous vaginal delivery, bouncing back to normal is very smooth and quick.
Okay.
That is first. I mean, the other one too is that we have to start exclusive breastfeeding as soon as possible.
Okay.
But then if you go in for cesarean section, we have to wait for you to recover because at that point in time, we give the C-spine anesthetic agent and it takes time for it to wear off.
Okay.
And even for some instances, we would have to extend the duration of the anesthetic agent that we gave because, at times, some complication may happen in the course of surgery and we will need to buy more time.
Yes.
So it enables us to, the baby, first of all, you start exclusive breastfeeding earlier. Okay. And then the other thing too is that, when after spontaneous vaginal delivery, even for your uterus to bounce back to normal, for your abdomen to go back to its previous state, the flat abdomen you want.
Yes.
If you go in for spontaneous vaginal delivery, you regaining that previous size is faster as compared to going in for C-section.
Okay.
And the other thing is that surgery is surgery, so there are complications you can experience. A number of them. I don't know if I can mention some of them. There are so many of them
I think
that when
you give us the two biggest ones or the two most serious ones. Just think,
okay, it's going to be a cut.
Yes.
Although we have curettes and then we have instruments to secure hemostasis or to stop the bleeding.
Okay.
Nonetheless, you can bleed.
Okay.
You can form hematoma. There can be blood clot formation even in the incisional site. At times, all the precautions can be observed, but still they do occur.
Yeah.
Infection happen. You know, we have the normal commensals on the skin, bacteria on our skin, and whenever there is any break, there, it means you've distorted the natural ecosystem there for them, and they can multiplicate there, and then we can have infection, which is very difficult to be managed.
Okay.
It's such insightful revelations, Doc. We're so glad you have passed through and given us this wonderful information. We would make you our in-house doctor and expert on medical matters. So
yes.
as often as we can, we'll be running back to you for more information. I hope that is fine.
Yeah, you are all the time welcome.
Thank you so much, listeners.
Thank
This
you,
is
Doctor.
Dr. Michael Bimpon, and he's just told us that let's nature take its course. God created you to you. Okay, welcome team.
You're tuned in to 101.9 FM, Z, your lifestyle, leisure, and business radio.